and young persons were surveyed on their sexual behavior. Dwayne Moody looks at the CAF report.
The 2013 report on the prevalence of HIV/AIDS in the country showed that over a 3-year period, the number of new cases of the virus had remained constant. 241 new cases were reported overall, and there are more men than women affected with the disease. But while the figures for the 2014 report are pending, there are indications that the number of new cases of HIV/AIDS is stable. Many factors influence that number, and to get an understanding of local demography, the National AIDS Commission sanctioned a survey on the knowledge, attitudes, and sexual behavior on HIV in Belize.
The CAP report is done, one, it helps the national response to keep track of its progress in key areas. Two, it is part of our global reporting system, because we have to report these indicators to the global UNAIDS mechanism, so that when they consolidate all the data from countries around the world, that's how they get the global picture. But nationally, we do it to track the progress in our response.
The survey, which was funded through the Global Fund of the United Nations Development Program, was carried out by the Statistical Institute of Belize, and the results were damning. The survey targeted primarily the youth between the ages of 15 and 24. Of the sample population, 61.2% have had sexual intercourse. Majority of them were out of school. 9% of the youth population, however, had their first sexual encounter before the age of 15.
Young people, especially the ones under 20, they are having sex. And we also recognize that there are a significant number of young people who are starting to have sex before the age of 15. So as it relates to those persons and reproductive health services being made available to them, we recognize immediately that there is an issue, because there is a conflict with what the law allows and what is actually happening in reality. So that is something for us to consider. Because we are seeing that just about 1/10 of the persons under 15, 1/10 of the persons who are sexually active reported that they actually start before they got to 15 years old. So it's a significant number.
But are the youths aware of sexual diseases plaguing the society and the preventative methods or even best practices? Demographer Jacqueline Small says yes, because the results show that 96% of the 15 to 49-year-old population has heard of HIV/AIDS. But there is need for more education and awareness, and from an earlier age.
Yes, there's more work to be done, but I think it is encouraging that our young people are using a condom at the first sexual encounter, which means that they are listening and they are learning, and there has been some behavior change. So investments have been made to affect young people's behavior. We might not be getting all the positive results that we had anticipated, but things are happening. It is now just for us to continue, step up the programs, expand the service to areas where perhaps before there was not an apparent need for great focus. Only 3/5 of the youths reported having used a condom the first time. So that's good. But it shows that only 1/2 of the youths who had had sex with more than one partner during the last 12 months had actually used a condom. And we know that multiple sex partners is one of the high-risk behavior. And while we are seeing that some of them are aware and they are using, we cannot afford to have this gap in this era in particular, because as you said, this is where excuse me, this is where a lot of the risk come in. So we really need to turn up the awareness campaign on this particular issue.
Garifuna youth, followed by the Creoles, are more engaged in sexual intercourse and at an earlier age. The lack of education makes them more susceptible to contracting the deadly virus. These trends support the HIV/AIDS report of 2013 that indicated that primarily in the South there are more HIV/AIDS cases. So what are the implications of the survey?
Because there is, as we can see, very early sexual debut, 16.4 years in the case of 15 to 19-year-olds, it's a little bit lower. It means that there has to be stepped up efforts for education, perhaps in partnership with parents, schools and parents, because I think that there has to be some common ground in terms of the approach to sexual education among young people, because the reality is that young people, even before 10, may be exposed to sexual education through social media, through the internet, through television, and so that is something that needs to be looked at. In terms of safe sexual practices, I think that certainly there is the need for a national condom program, and that is something we're looking at. The key issues there are two. First, availability, and then affordability, because we need to know, one, that maybe we need to establish that in the areas where there's not high usage of condom, it doesn't necessarily mean that it's because of a tendency towards unsafe sexual practices, but more it could be issue of economics. Can people afford condoms? So we need to establish those.
Proper interventions will now be implemented. Dwayne Moody for News 5.